All right, today we are taking a deep dive into the ovaries. We're going to clear up something that a lot of people have heard of, but maybe don't fully get the real difference between our common cyst and a more complex tumor. So let's get into it. You've definitely heard the term ovarian cyst, right? Maybe a friend mentioned it or it came up at a doctor's appointment. And it can sound kind of scary. But what are they, really? Are they all bad news? That's what we're here to figure out, to give you some real clarity. First things first, you have to understand that an ovary isn't just sitting there doing nothing. It's more like a busy, dynamic little factory that's constantly changing and working as part of the menstrual cycle. And because it's so active, it's totally normal for little things to pop up and then disappear. This idea is absolutely key for what we're about to cover. So let's start with the most common situation by far. Perfectly normal, what we call functional cysts. These are the kinds of cysts that are usually just a side effect of the ovary doing its job every month. The most common one of all is the follicular cyst. Okay, so every month, this tiny little sac called a follicle gets an egg ready for ovulation. Normally, it's supposed to pop and release that egg, but, sometimes it just doesn't. It holds on to the egg, keeps filling up with fluid, and voila, you've got a follicular cyst. And the follicular cyst has a cousin, the luteal cyst, which forms after the egg has been released. Now, they look a little different on the inside. One's got clear fluid, the other has this distinct yellow wall, but they have a lot in common. Both are directly tied to your cycle, you often don't even feel them, and here's the most important part, the vast majority of them just go away on their own. No drama. Okay, so those are the simple ones, but what happens when cysts are part of a bigger puzzle? Sometimes they're not the problem themselves, but a symptom of a larger underlying condition. This is where things can get a bit more complicated. A classic example here is polycystic ovarian syndrome, or PCOS. With PCOS, we're not talking about one or two cysts that come and go. No, this is a hormonal issue that causes the ovaries to become enlarged and develop lots of tiny cysts, often arranged right along the edge, kind of like a string of pearls. And that's the real kicker. Why does this matter so much? Because PCOS is the #1 reason for infertility that's caused by a failure to ovulate. The hormonal chaos at the center of PCOS just throws the whole system off and prevents the egg from being released. And the effects of PCOS go way beyond the ovaries. It's a full body issue. The hormone problems can show up on the outside as things like irregular periods, acne, or excess hair growth. But underneath, they're creating much deeper metabolic issues, like insulin resistance, which bumps up the risk for obesity, diabetes, and even problems with the lining of the uterus. Okay, another major condition that can bring ovarian cysts into the picture is endometriosis. This is when tissue that's supposed to be lining the inside of the uterus decides to set up shop in places it absolutely shouldn't be. And one of its favorite spots is on the ovaries. And when this tissue starts growing on an ovary, it can form a very particular kind of cyst, one with a name you won't forget, a chocolate cyst. And I promise you, it has nothing to do with dessert. So why the name? Well, that tissue, even though it's on the ovary, still thinks it's in the uterus, so it bleeds every month with the cycle. But that blood has nowhere to go. It gets trapped inside the cyst, and over time, it gets old and thick and turns a dark brown color, which looks like melted chocolate. These cysts, also called endometriomas, are notorious for causing serious pain and can be a major factor in infertility. All right, let's take a breath here. So far, everything we've talked about has been a cyst, basically a sac filled with fluid, often tied to how the body works. Now, we're going to make a huge leap to a totally different beast, ovarian tumors. This right here is the single most important distinction to get. A cyst is usually just a fluid-filled sac, but a tumor is something else entirely. It's an abnormal growth of new tissue, what a doctor would call a neoplasm. And that new growth can be benign, meaning not cancer, malignant, which is cancer, or something in the middle, called borderline. So these tumors can actually start from different kinds of cells inside the ovary. But as you can see from this chart, the vast majority, that huge slice of the pie, comes from what's called the surface epithelium. That's just the super thin layer of cells covering the outside of the ovary. and that's what we're going to focus on. Now, when we talk about how these tumors can become cancerous, scientists basically see two different paths. First, you have type 1 tumors. Think of these as the slow burn. They progress in clear steps, going from benign to borderline to a low-grade cancer. Then you have type 2 tumors. These are the wildfire. They seem to pop up out of nowhere as aggressive, high-grade cancers. And get this, a lot of research now suggests many of these might actually start in the fallopian tube next door and then spread to the ovary. Just fascinating.
Okay, so let's zoom in and decode the two most common types of these epithelial tumors you're likely to hear about: serous and mucinous tumors.
Let's use serous tumors to really see the difference. When it's benign, it looks pretty simple. A smooth, thin-walled cyst with maybe a few small bumps inside. But when it becomes malignant, a carcinoma, look at the change. It becomes more solid and irregular. The growths inside get big and complex, and worst of all, the cancer cells can break through the wall and spread. Under a microscope, it's just as dramatic. What was a nice single layer of cells becomes a chaotic, disorganized mess of cells dividing like crazy.
The other common type is the mucinous tumor. And these things are famous for one thing in particular: their size. I mean, they can grow to be absolutely gigantic. The source material mentions cases weighing over 25 kilos. That's more than 55 pounds. It's just incredible. They get filled with this thick, sticky, mucus-like fluid. The good news is the huge majority of them are benign or borderline. True mucinous cancer starting in the ovary is actually pretty rare. So after all that, from the everyday functional cysts all the way to these massive, complex tumors, let's just boil it all down. What does this actually mean for you?
This right here is the absolute heart of it. If you remember one thing, make it this. For a cyst, which is often just a byproduct of your body doing its thing, the question you ask is practical. Is it causing a problem? Is it painful? Is it big? But for a tumor, a new growth of actual tissue, the question is completely different. It's much more urgent. Is it benign, borderline, or malignant? Getting that distinction changes everything. Honestly, just understanding that fundamental difference is the most powerful first step you can take. It helps demystify your body and lets you have smarter, more confident conversations with your doctors. So I'll leave you with a question to think about. What's the one thing you learned today that's going to stick with you and help you feel more empowered about your own health?